Hello everyone, my name is Sarah Waits and I work in the operating room, so I chose to do my clinicals at the operating room at St. Elizabeth's. I chose surgical smoke evacuation as my project for this practicum. There's a couple reasons. I kind of wanted to make sure that it was something that would actually influence and help my unit. And there was a couple of girls there that were already trying to get it started but had no real backing or drive to get it going, so I decided to take it under my wing and go for it too. So for my presentation, I did a PowerPoint that described what it was, exactly what surgical smoke plume was, and I was appalled to find how hazardous it is to everyone involved's health. Statistics like 1 gram of tissue equaling 6 unfiltered cigarettes. Some of the signs and symptoms are very, very vague as far as like nausea, headaches. I mean, things that we push off to other, just other ailments we just think of every day. And we see this constantly in the OR, and we were very, very low in education and use. I mean, we literally were only using about 1% of smoke evacuation, and this was only in laparoscopic procedures with the GYN doctors. So there was nowhere to go but up. So that was the good news. Bad news is there is a lot of pushback, and I started talking to the director about doing this project, and all of a sudden it got pushed for really, really quickly, so I kind of ran out of time to truly get a lot together. But they made it mandatory for the surgeons to use, and if anybody knows their doctors, you know that's not always a great thing. They like having a say in what they do, so that was one of my biggest pushbacks, is the surgeons not liking that they had to use these, and really they just weren't educated. I was told that the chief medical officer was going to discuss it with the doctors before implementation, and unfortunately that did not happen, so it was kind of a surprise to them as well. So we've done a lot to work on getting other equipment for them. Many of them have said they don't really like the equipment that we've been using for this. It's supposed to be very similar, but we use electrocautery to cauterize the wounds and cut as we go. And the pencil that they use for it is a little bit thicker, so they're not real fond of that. And the evacuator itself can be noisy at times. Now we have worked on that, and there are ways to turn that up and down, but many of them are kind of stuck in their ways, and that's okay. We're working on it. But the overall, everything's been going fairly well. It's going to definitely be a continuing process. If I would have done it differently, I definitely would have made sure that everybody was on board. But we're probably at about 95% smoke evacuation, so I think that's a pretty good jump considering. And I think it's beneficial to both the staff and to patients. I mean, it truly is an infection control issue. There's living and dead organisms within the smoke plume, and there's also carcinogenic components of it. So it's definitely beneficial for everybody to participate in this and not be exposed to the smoke plume. Unfortunately, another one of our barriers is that there's no mandates that it has to be used, which is why a lot of ORs don't have it into effect. It's up to the facility itself to put policy and procedure into place in order to enforce it. OSHA says it kind of falls under their uh, work safety guidelines, but that can be so misconstrued in so many ways, and like that leaves a lot of loopholes for the facility itself. So thankfully I've had a lot of upper management. The director of surgery was on board with this, and the chief medical officer, and majority of the staff have been really great with taking care of it. I did have some of my older staff really have a hard time with it. Um, some of them just, they don't do real well with change, and that's okay. We're working. And so um, I guess really I don't have much more than that. The biggest thing is it's a work in progress, and every day gets a little better. I have multiple uh, things in the works. I've been working with different reps to see about different products, but it comes down to cost effectiveness and surgeon preference. So wish me luck. Um, I guess the other big thing is for any of you that have been reading the discussion board and that, I am still in the process of the interviewing for the management position, and that's another reason that this has really been a great experience for me, because it's allowed me to show them the leadership skills. Unfortunately, it's kind of been put on the back burner because our director of surgery has just announced that she is leaving, so there has to be somebody to fill her place. And unfortunately, you need a master's degree for that, so I can't even try to fulfill those shoes at this point in time, but it's a long-term goal, and I hope that the new director has the same confidence in me as this one does, and hopefully I will get the position. Thank you all for listening, and it's been a great 8 weeks with everybody, and I wish everybody luck and congratulations on their graduation. Take care. Bye.